Uganda is the largest alcohol consumer in East Africa. The country also has the highest number of alcohol-related deaths in the region. On average, the per capita consumption of pure alcohol in Uganda stands at 9.8 litres per year. This is greater than the global average of 6.4 litres and the African average of 6 litres. 89% of alcohol sold in Uganda is unregulated. Most of it, according to the World Health Organization, is brewed and illegally sold. This is because home-brewed alcohol like Tonto, Malwa, Kasese Waraji and Omuramba are cheaper than the factory-produced branded beverages. This implies that consumption is higher in poorer segments of society in both rural and urban areas. While the country is home to a vibrant party scene, Youth for Policy fellow Brian Sserunjogi in his paper, Alcohol Consumption Among Youth in Uganda argues for policy intervention. Currently, alcohol consumption within Ugandan school environments is on the rise, and this is directly linked to dropouts, absenteeism, and poor academic performance. In Uganda, Uganda's youth aged between 15 and above consume larger quantities of alcohol per year than their counterparts in Kenya, 4.3 litres, Burundi 9.3 litres and Tanzania 7.7 litres, and estimates project that this trend will only worsen by the year 2025. Relatedly, alcohol consumption decreases work productivity, increases road accidents, and increases the risk of unsafe sexual practices. Currently, despite the large social, health and economic burden associated with alcohol abuse, regulation remains an overlooked conversation. In 2016, Uganda registered a total of 108 deaths per 100,000 people from liver disease linked to excessive consumption of alcohol. The country also registered the highest number of alcohol-related deaths from road accidents. Also worth noting is the fact that a third of patients at the country's main mental hospital, Butabika, have mental disorders resulting from excessive use of alcohol. In his paper, Brian underscores the need for a national alcohol policy and strategy to effectively enforce measures to limit alcohol availability, advertising, marketing, and pricing in Uganda. While existing laws regulate the manufacturing and licensing of alcohol, Brian suggests that these need to be amended to bring about meaningful deterrence to excessive alcohol abuse. Currently, Uganda has no national action plan to comprehensively reduce the harmful use of alcohol. While existing laws spell out hours of selling, there exist no restrictions on places and number of alcohol selling outlets per geographical area. Additionally, alcohol companies freely advertise and sponsor events that mainly target the youth. Drawing from policy successes in South Africa, Peru, and Finland, Brian recommends that there is need to introduce a national policy to regulate the manufacturing, availability, advertising, distribution, and marketing of alcohol in Uganda. He also recommends the amendment of existing laws to introduce tougher penalties for offenders and introduce new provisions such as restriction on the number of alcohol selling outlets per area and the sale of sachet alcohol.